Your heart beats thousands of times every day, quietly pumping blood through your entire body. But what happens when the arteries that feed the heart become narrow, blocked, or damaged? What happens when the heart muscle becomes weak, the rhythm becomes abnormal, or the valves stop working properly? Heart disease is not one single condition. It is a group of diseases that can affect the heart and blood vessels. And sometimes, the first warning sign can be a heart attack. Cardiovascular disease remains the leading cause of death globally, and many of its major risk factors can be prevented or controlled through early detection, healthy lifestyle changes, and medical treatment. What is heart disease? Heart disease is a broad term for conditions that affect the heart or the blood vessels connected to it. The most common form is coronary artery disease, also called coronary heart disease. It develops when plaque builds up inside the arteries that supply blood to the heart muscle. This plaque can contain cholesterol, fat, calcium, and other substances. Over time, it can narrow the arteries and reduce the supply of oxygen-rich blood to the heart. If a blood clot suddenly blocks blood flow, a heart attack can occur. How does the heart work? The heart is a muscular pump divided into 4 chambers: the right atrium, right ventricle, left atrium, and left ventricle. The right side receives oxygen-poor blood from the body and sends it to the lungs. The lungs add oxygen to the blood. The oxygen-rich blood then returns to the left side of the heart, which pumps it through the arteries to the entire body. The heart itself also needs oxygen. Special blood vessels called the coronary arteries supply oxygen and nutrients to the heart muscle. When these arteries become narrowed or blocked, the heart may not receive enough oxygen. The main types of heart disease. Heart disease includes several major conditions. Coronary artery disease affects blood flow through the arteries that supply the heart. Heart attack, or myocardial infarction, occurs when blood flow to part of the heart muscle becomes severely reduced or blocked. Heart failure occurs when the heart cannot pump enough blood to meet the body's needs. Arrhythmias are abnormal heart rhythms. The heart may beat too fast, too slowly, or irregularly. Heart valve disease occurs when one or more valves do not open or close properly. Cardiomyopathy affects the heart muscle itself. Some people are born with congenital heart disease, meaning a structural problem develops before birth. How does coronary artery disease develop? One of the most important processes behind coronary artery disease is called atherosclerosis. The inner lining of an artery can become damaged by factors such as high blood pressure, smoking, high cholesterol, diabetes, and other forms of inflammation. Cholesterol and other substances can accumulate in the artery wall, forming plaque. As plaque grows, the artery becomes narrow. At first, a person may have no symptoms, but as the narrowing becomes more severe, the heart may struggle to receive enough oxygen, especially during physical activity. This can cause angina, which is chest discomfort caused by reduced blood flow to the heart. Sometimes a plaque can rupture. The body may form a blood clot at the damaged area, suddenly blocking the artery. This can cause a heart attack. Heart disease risk factors. Some risk factors cannot be changed. These include age, family history, and certain genetic factors. But many important risk factors can be controlled. High blood pressure places extra force on organ and increases the risk of heart